Okay, um, that's just a kitty. She's not feeling good. Yeah, she's going through that time of the month for her. Yeah, Sabrina, it's okay. So, it's been a month. Yeah, since my last video. I've been having a lot of dysphoria about down there, and a lot of anxiety, doing the best I can, and still getting electrolysis, which is going very well. It's just it's taking a little bit longer than I want because more people have been booking appointments lately, so I haven't been able to go every week since that long month in between. I had to wait after it was all cleared. So what she's been doing this time was she got the bulk of everything on top. Now she's doing the regrowth on top and shaping it. So everything on top. So the whole left side on top is done. We have to finish the right side. Then the whole entire bottom half needs to be done again. So my appointment won't be till Friday, so yeah. Let's see what else has been going on. Well, my first therapist wants me to continue to meet people. And when I was talking to my second therapist about some of the issues I've been feeling and dealing with about how I've just been feeling towards like sex, a partner, relationships type stuff. And how it's kind of hard to meet people with virus and everything out there. She decided, she was like, what if I give you the homework assignment of joining a dating site? And it's like, how would you feel about that? And I just told her I would feel awkward. So she was like, how about you narrow it down to 2 sites? So I'm like, okay. So I've been looking into that as a possibility to meet people. Sorry about the lighting. The window's right there. And there's no curtains up just yet. So yeah. So been trying to deal with that. It's kind of a struggle. But because some people, it's because I was going on a lesbian, like in a lesbian chat room on the website Chat Avenue, and there's a lot of people who are kind of ignorant, and some people who are guys in a lesbian chat room. So I'm like, okay, why are there guys, like men, in here? And there's some women who like trans and some who don't, and it's like, yeah. And most people who are interested live too far away, or they're in a relationship, or different countries and stuff like that. So that's why it's recommended it as a homework assignment to narrow it down to 2 dating sites. I possibly won so far, but the thing is, I can't afford a paid dating site because I'm using the money for electrolysis. I'd rather get the electrolysis done because that's absolutely necessary to have done for surgery. So, yeah. Okay. Because since that, it's gonna kind of like a little bit nervous about something like that, dating. I haven't been in a relationship since January of 2006. That first week of January of 2006. It's been that long. Even though I've had sex and stuff like that since then, 9 times altogether. And it's been over 2 years since the last time I've had it. If you've seen that video, or I talked about my experience as a trans woman with it. Yeah, that was the last time I had it. So, and some of the feelings is, there's days where, because hormone fluctuation is some days where I really want it, and some days where I could care less. But it's kind of frustrating having a high female sex drive. So, the other issue, going off of bicalutamide, I personally started gaining excess body hair. How I mentioned it was causing some dysphorias with the facial hair, which never happened before. And how I went back on bicalutamide, then I went off of it, because what happened was I was put back on bicalutamide, but I was having increased spontaneous orgasms after they significantly dropped off. So I stopped taking it because my appointment was with electrolysis, and I didn't want to have spontaneous orgasms, so I just completely stopped taking it because my therapist decided I don't need to be on it because it's not doing anything for my testosterone, because my testosterone came back at 14. So it was that testosterone difference, because it used to be around 4 to 8, then that difference up to 14. That difference of 6, it was causing some issues. So I was put back on finasteride, but I was put on 1/4 of a dose this time, because the last time I was on finasteride, I was getting sick a lot during that time. So, how I said I would never take it again? Well, because I was getting sick a lot during that time. But because I was put on 1/4 of a dose, I'm doing a lot better. I'm doing fine. So, I'm not having that issue of getting sick. So, that's good. So, what I've noticed is the skin around my breasts are a lot firmer since being on the finasteride. The hair I was gaining on my legs, where I didn't have hair anymore, kind of seems like it's going away. My facial hair is growing a lot slower. That excess hair was starting to grow in the tummy areas, growing slower and going away. It looks like my leg hair is thinning a little bit, which the right leg has less hair than the left leg, especially on the inner part right here on the bottom half, like right there. It's weird, but it is what it is. But the bikini line, that hair hasn't seemed to go away. And the thing is, it can take time, because finasteride is meant for people who, usually it's taken in men who have prostate cancer. It instantly stops male pattern baldness. And then it gets rid of excess body hair like facial hair. So the awkward story is, when I had the prescription filled, I was hoping I would get a pharmacist that knows me really well, knows my situation. Because I heard there was a new pharmacist, which I've never seen before. So when I get to the pharmacy, it was the new pharmacist who didn't know me. So he was explaining, this is usually taken in men with prostate cancer. So when you're taking it, and here's the awkward part, he's like, so when you're taking it, you have to be careful not to get pregnant because it messes with testosterone levels. Then he asked why I was put on it. So I just told him, I'm taking it because when I went off bicalutamide, I started to have excess body hair. And then when I left the pharmacy, I was like, because what came to mind instantly was like, he's seeing me as a woman. He doesn't know I'm trans. It's like, he's seeing me as a woman. He doesn't know I'm trans. And I'm pretty lucky on that. And it's like, I don't really think about that much lately. But lately, I've been actually noticing that. Lately, it's like, my encounters lately, no one knows I'm trans. They just see me as a female. And compared to those ignorant people who say that trans is men and always will be because we were born with a penis, or anyone born with a penis, that means cisgender women that's born with it due to birth defects and other conditions that may happen that can cause it. So I hate people like that. It's like, I don't need people like that in my life, so yeah. The other thing is, recently, a few days ago, went and had taxes done because we weren't sure how it was supposed to be done for me, being on disability. So my mom made the appointment. We were able to get in that day. It was about like 8 at night. So yeah, it went well. Turns out I had to file my own. And they explained it all. So, and the way they do taxes now, a lot of it's changed. So, especially with the pandemic, the virus, and everything that's going on, there's things that's been changed around. So I was able to, because who wasn't able to get the stimulus check before, who even didn't get it, was able to get it this time. You just have to file for it with taxes and stuff. So they took care of all that. So I'm actually getting that, which I was thinking, how am I going to continue paying for the electrolysis when I still have 4 more months to go. 4 more months till surgery to go. So, because my insurance doesn't cover it, it covers surgery, but it won't cover that specific thing. Some people's insurance will and some won't, so it sucks that mine doesn't, but anywho, electrolysis is good to go still. It looks good. Hopefully the money comes in so I can continue getting that done. So until that gets deposited into my account, I'm just going to use the regular payments I get and hope she can get as much done in the next few sessions as possible so that I don't have issues. Because I don't want to have any touch-ups after surgery, especially on top when they do the clitor and hood and the clitoris and all that with the maybe Manjora and all that on the top half. Because she was saying there would be a new nerve bundle and it can be more uncomfortable, more painful. So I don't want that. So yeah, then having to do the labia minora and Manjora on the bottom half would be like, especially the where the urethra would be and the vaginal canal. I don't want to have electrolysis done in those areas. That would be like really uncomfortable, especially after going through all that pain and healing. Yeah, I don't need more. So, yeah. And there's a very specific way I've been wanting the surgery, how everything, the look and function. The best way I can describe it is, since being on hormone replacement therapy, especially what I'm on now, the tip of my penis And I'm not lying about this or joking about this. It's the actual truth. I don't know why. I've tried doing research on it. Because mine on the tip has an extra hole above the urethra. It's like there's a mini space in between. So there's the urethra, then an extra hole above it. But then when I got on hormone replacement therapy and over time, because I was trying to do research on that extra hole, why some people have it and some people don't. Because usually that top hole will be the urethra and it won't be the bottom one. But for me, the bottom one's the urethra and the top one is just an extra hole. But then the hormones changed the way the tip looks, and now it looks like a full vulva. Looks like there's a labia minora, labia majora, a clitoris, clitoral hood, and that extra hole looks like it's the vaginal canal, and the urethra looks like it's an upside down vulva. So I'm like, okay, that's weird. So then I was thinking, well, if it looks like that now, that means if my genitalia was formed female from birth, that's probably how my vulva would look. So I want my vulva, if you take that, turn it right side up and make it even and proportionate to my body size and shape. That'd make me really happy to have it to look like that. Plus, the way I want it to sexually function is the female version of erection, meaning the clitoris, the internal erectile tissue, to function as so, and all that, to be sensitive. And the vaginal canal to create its own fluids sexually and non-sexually, which they can get it to do that. And I want the urethra placed far enough away from the vaginal canal so when fully penetrated, it's not being blocked off. And I want it evenly spaced between the clitoris and the vaginal canal. Not too close to the clitoris and not too close to the vaginal canal. So when being penetrated fully, it's not being blocked off, because I've learned the reason why some people can squirt and come and some people can't squirt. Squirting and coming are two different things. It's because the urethra is too close to the vaginal canal, and when being penetrated it blocks it off, so the fluid can't release from the body. Even though it's happening, it's not being released from the body because it's being blocked off. That's why I need it far enough away from the vaginal canal so that doesn't happen. Because having that function now, because I'm able to on the doses of estrogen and progesterone, especially taking the estrogen every week, once a week, and the progesterone at 200 milligrams every night when I go to bed in the suppository route. And I figured it out. When the G-spot's stimulated just right, I'm able to squirt. And having that function helps with my mental state, like the mind-body connection. And I still want to continue to have that function, so yeah. So that's why I want it done that way. And haven't really noticed much changes, but my butt's fuller and my breasts are somewhat fuller. A little bit. And my breasts are staying up in size around 39.5 inches, but not the fullness. It's more starting to stay up that way a little bit more lately. Except when I had that hormone fluctuation where they went down in size a little bit due to hormone fluctuation, but went back up. So that's good. Just to see how everything goes. And I'm sorry the videos haven't been uploaded. Well, it's been really, really late getting everything done. Don't have the internet, and my laptop fan needs to be fixed before I can, do all the editing. So, that's one thing that's good about that stimulus money. We'll be able to get my laptop fixed, so, So, until my next video, please comment, rate, and subscribe. And I'm still here, I'm still alive, I'm still getting everything done the best I can right now. So Till next time, comment, rate, and subscribe, and I got new glasses. 2 pairs. What I'm wearing now and this pair. So, yeah, until my next video. Peace!